I'm here on the grounds of Washington Adventist University in Tacoma Park, Maryland, which shares a campus with Washington Adventist Hospital. Over a century ago, Ellen White, co-founder of the Seventh-day Adventist Church, walked these very grounds, noting her high hopes for the ministries of healing and education that God would build here through His church. After 100 years here, we're looking to expand these ministries by building a new hospital nearby and transforming this space into a village of health and well-being.
Over 100 years ago, Ellen White was inspired with a vision to bring an Adventist presence to the Washington, D.C. area. This vision would develop to include the very first hospital in Montgomery County, Maryland, the Washington Sanitarium and Hospital, or today known as Washington Adventist Hospital.
Ellen White said we need to have a presence in the nation's capital. We need to be in Washington, D.C. And so with her vision, the hospital became a reality in 1907. And of course, a lot's changed over the last 100 years. As the years passed, it became more and more apparent that we had to think about fundamentally what is the future of Washington Adventist Hospital. Our mission's the same. Our mission's always been the same. And that is we demonstrate God's care by improving the health of people and communities. But as we began to think about the future, and we began to think about how do we best serve the community, how do we stay true to that mission, we knew that we had to make some pretty radical changes.
To help facilitate the growing needs in the Washington metropolitan area, leaders at Washington Adventist Hospital have developed a plan of action that will help expand their mission of care and provide access to even more people across the region.
We developed something that we are very excited about. It's called the Vision for Expanded Access, which really became a reality in 2005. The key points are related to the relocation of Washington Adventist Hospital and why we're doing that, and then the reuse or the continuous use of the Tacoma Park campus.
We have been blessed to find a piece of property very close by to our historical service area. It's a natural, undeveloped setting just across the way from the General Conference that allows us the opportunity to develop a full 288-bed replacement hospital that is compatible with modern 21st century standards and also compliant with green building requirements. In this hospital, we'll be able to provide a safe and healing environment. We will draw nature into that environment for our patients and for our caregivers. And we will do this in a fully private bedded facility.
Well, as a board member and as a community leader of one of our local churches, I very much support the planned expansion. There are other underserved populations that need to be addressed and that we can expand and meet those needs without abandoning the persons that we've been serving for 100 years.
Indeed, a remarkable step forward after over 100 years, Washington Adventist Hospital's relocation is a necessary step to effectively reach the growing community. But what will happen to the current campus in Tacoma Park?
The Adventists are not leaving Tacoma Park. The hospital is not leaving Tacoma Park. In fact, we are going to make it better because of this vision.
Building on the hospital's legacy of excellence, a fresh collaboration between Adventist Healthcare and newly renamed Washington Adventist University will seek to refocus the Tacoma Park campus into a shared initiative of education, health, and wellness.
The goal is to build a relationship that not only benefit both institutions but also the community. And we wanted to demonstrate to the community that our presence will remain here in Tacoma Park for a long time. And we wanted to start a project even before the hospital moves. And we have decided on a fitness center, health, wellness fitness center, that will be utilized by the hospital and the university and the community at large.
And so the campus will have, of course, an expanded university with more students, training more students for the future. It'll have primary care services, which means family practice physicians, internal medicine doctors on this campus, Urgent care is a very important part of the campus. And when you think about it, when you think about the needs of a community, and not just this community here, but communities all around us and really all around the country, the most important thing is access to high quality primary care and urgent care services. And so that's what we're going to do here. We're going to focus on that.
An exciting new chapter in the vision for Washington Adventist Hospital is well underway, and with a renewed collaboration with Washington Adventist University, the mission of Adventist healthcare in the Washington metropolitan area is expanding.
The partnership that we are establishing, I'm excited about because our missions blend very well. And as we move forward, the collaboration, the partnership, the blending of our pillars of excellence really supports our mission and their mission. And the individuals who will profit from this partnership are our students and the community at large.
And one thing I remember as a small child, my dad used to always tell me, he would say, prepare as though Christ will come today, but plan for the future. And so that's what we're trying to do. We're trying to live certainly each day as though this could be our last day here on this earth, and that we're prepared. But also, we have a responsibility to the church, and we have a responsibility to our communities and to our mission to make sure we're prepared for the future as well, because we do not know the day or the hour.